Right, this is Mr. Allen, and he's coming to the hospital. He's admitted in the ICU, the intensive care unit, and I'm the senior house officer. My task is to take a sample for ABGs and do the ABGs, arterial blood gases. I'm the senior house officer. That's my task. Hello, examiner. This is my reference number. Can I please proceed?
Yes.
Right, thank you. In a real patient, in a real scenario, first of all, I'll greet my patient. I'll check the identity of my patient. I'll introduce myself. I'll tell that the purpose of my visit is to collect some blood from his deeper channels of his arm and his hand. For that purpose, I'll ask him for any arm preference, any arm soreness. I'll ask him to roll his sleeve up, and I'll also offer my patient a privacy and also request for a chaperone. I'll warn my patient that if I do not succeed in this first attempt, I might have to repeat the procedure again, and that the patient will feel a sharp scratch, right, during the procedure. May I know, please, where my clean area is?
This is your clean.
Right, thank you. Right. Can I please have a bubble remover?
I don't know.
Right, thank you. Okay. I cannot appreciate the radial pulse. Okay, thank you. Can I please have a pair of plain gloves? I mean, simple. Can I have a pair of gloves?
Assume you are.
Assume? Right, thank you. Right. Before proceeding any further, I would like to do Allen's test. Would you like me to show you what Allen's test is, doctor?
Yes.
Right. I'll ask my patient, first of all, I'll obliterate both the radial and the ulnar artery. I'll ask my patient to tightly clench his fist. And after that, I'll check for blanching. I'll remove my finger from the ulnar artery and check for reperfusion. If it's less than 7 seconds, I'll proceed on taking the sample. Thank you. I know where my clinical waste bin is, please.
This is your.
Okay, thank you. Clinical waste bin. I'll warn my patient that he'll be feeling a sharp scratch. I'll hold it, apply pressure myself for 3 to 4 minutes. I'll take it myself to the ABG machine. If it's not nearby, I'll label it with my patient's details, his date of birth, his hospital number. I'll also write down the name, the concentration of the oxygen that my patient is on, his oxygen saturation and temperature of my patient, and I'll immediately send it off to the lab for testing. And when I'm done, I'll thank my patient and ask him to unroll his sleeve. Thank you.
Should we have to write our own name on the syringe or not?